Tell me about your 3 weaknesses. A door opens to showcase not only your humility but also your unwavering commitment to become an exceptional physician. Now, I agree this question could be one of the most trickiest questions that you may face. However, when answering this question about your weaknesses during an residency interview, it is essential to approach it strategically. The interviewer is interested in understanding your self-awareness, your ability to identify areas for improvement, and your willingness to address those weaknesses. They also want to assess your honesty and maturity, how mature you are in basically acknowledging the areas where you need further development. As usual, I'm going to be giving you a sample answer. Don't make it robotic. Practice it enough that you sound natural and does not appear that you have, memorized it. Before jumping into that, you need to understand the basic concepts behind this question. Number 1, choose relevant weaknesses. Select weaknesses that are applicable to the medical field and demonstrate your commitment to personal growth, and avoid generic responses or unrelated weaknesses that may not even relate to you. Then be honest and do not be overly critical. It is important to be, of course, genuine, but avoid listing weaknesses that could be detrimental to your candidacy. Frame your weaknesses in a way that highlights opportunities for improvement and growth. Then, of course, you have to discuss self-awareness. Discuss how you became aware of your weaknesses, whether through feedback from mentors or, personal reflection. Demonstrating self-awareness illustrates you are mature and you have a proactive attitude towards self-improvement. And then, of course, you have to describe your efforts to overcome this weakness. Discuss concrete steps you have taken to address your weaknesses. Explain how you have sought resources, sought feedback, or engaged in professional development activities to look to improve some of these areas. And somehow turn it into a type of a strength. After discussing your weaknesses, emphasize your strengths and show how they actually compensate for or complement your areas that you are looking to improve. This showcases a balanced approach and demonstrates that you have been a well-rounded individual and you have well-rounded skills. And now for the sample answer, and I will try not to make a mistake here, but let's see how it goes. Well, I believe self-awareness is crucial for personal and professional growth, and I've spent time reflecting on this question that I know is a question that is commonly asked. 3 weaknesses I have identified are: 1 is time management, then presentation or public speaking, and then is delegating tasks. So time management has been an issue for me in the past, where I would go into detail and make sure everything is perfect before I actually move on. But I realized over the years that is probably not the best approach. I have actually implemented strategies such as creating scheduled tasks, and I write things down and I see what is priority over something else. I've also actually asked guidance from my mentors and my seniors who have been there, done that, and they have showed me that you don't have to worry about perfection at every stage. You have to see what is required at that particular step. So I believe I have made significant strides in managing my time appropriately. Then about public speaking or my presentation skills, and in the past, whenever I had to, step in front of the class and talk about a topic or do a presentation, I would sweat, and that used to be a terrible situation that I used to go through in the past. But I recognize that, and I realize that is something that I have to work on. And I'm proud to announce that I did, and I believe I am much better now than in the past. Then the last weakness was to be able to delegate tasks effectively. So as I mentioned with the first weakness, I'm a bit of a perfectionist, and sometimes I take too much responsibility on myself and I take unnecessary stress on myself. And I realized that, okay, this is probably not good, and I should actually trust other people's abilities. And I know that's what you need to do as part of a team. And just to relate to you, when I was in the final year of my medical school, I had junior students with me, and I would be part of a team, and I would let them know, okay, you can go interview this patient, you can see this patient in the ER, and please present to me, and we will talk to the attending together. So I overcame this weakness as well. This is something of a bit of a hindrance that I had in the past, but I believe I have changed and I will be much more productive down the line in the future. So having disclosed a couple of these things, that I'm confident that my dedication, my strong work ethic, a continuous learning mindset will enable me to overcome any barriers or any difficulties that I may come across, and I hope to bring my best foot forward. Thank you so much for asking this question. So I hope this was a reasonable answer, and I hope that this, helps you out. But I want to go into the philosophy behind this question so that in your particular situation, you can answer this question appropriately for yourself genuinely. And this question about weaknesses serves multiple purposes during an interview. Firstly, it assesses your self-awareness and your ability to recognize areas for improvement. It also evaluates your honesty and sincerity in addressing your personal weaknesses. You have to demonstrate your commitment to professional growth. Furthermore, the interviewer aims to assess your ability to reflect on your feedback that people may want to give you and take proactive steps to overcome any of the challenges, because residency is rigorous and you will be facing challenges. And interviewers are not looking for perfect candidates, as everyone has areas for improvement. Instead, they look for individuals who are aware of their weaknesses and demonstrate a genuine desire to develop and grow. And your response to this question provides insight into your attitude towards personal and professional development, your resilience, and your ability to adapt to new challenges. So keep that in mind. Now, what to avoid when answering this question? Number one is insincerity and deflection. You cannot also provide generic answers like, I am a perfectionist and that's basically it. I don't have any problems. I don't have any weaknesses. Or, trying to spin a strength as a weakness can come across as being insincere or deflecting the question. You have to be a little genuine. Then avoid mentioning irrelevant weaknesses. Then avoid mentioning something that is a critical weakness and that could raise concerns about your ability to actually perform as a resident. It is important not to highlight weaknesses that could be detrimental to your ability to perform effectively as a resident. For example, mentioning your poor attention to detail or difficulty in critical thinking would seriously raise concerns about your suitability for this type of role. Then you should avoid any lack of self-awareness or unwillingness to improve. A response that indicates that you have no weaknesses or refusing to acknowledge areas for improvement can signal a lack of self-awareness or any willingness to address personal growth. Keep that in mind. And then the things that you should never ever say. Avoid making derogatory or negative remarks about yourself or your abilities. This is not the time to undermine your confidence or present yourself as an unfavorable candidate. Stay positive, focused, and professional throughout your response. Remember, the key is to showcase your self-awareness, a commitment to growth, and a proactive attitude towards addressing weaknesses. And by providing a thoughtful and honest response, you can demonstrate your readiness to learn and adapt during your medicine residency training. And of course, this is just one answer, but I have a list of 25 questions with some appropriate answers, brief answers for you guys in the description with the link below. If you want to check that out, do see that. And this is, of course, not enough. If you want to go over exact details of how to answer, tell me about yourself, check out this video right over here, or you can subscribe to the channel over here. This is Dr. Umar Khan. Thank you so much. Talk to you guys soon. Bye-bye.